Hi everyone, welcome to our first web series here at the San Francisco Community Health Center. My name is Rowland, and we want to do this series for you all to just get to know us a bit personally. So yeah, let's start this off. So my name is Rowland. I'm the program specialist with the Connection underneath the HIV prevention team, and I use he/him pronouns.
Hi, everyone. My name is Jared Gonzaga. I'm the HIV prevention coordinator here at SFCHC. I use he, him pronouns, and I'm with the HIV prevention team.
Hi everyone, my name is Rence and my pronouns are she, her, and hers. I do PrEP navigation under the HIV prevention team here in San Francisco Community Health Center.
Hi, my name is Carson. I work as program supervisor at TransThrive at San Francisco Community Health Center. My pronouns are he and him.
All right. Well, thank you, everyone. And thank you for staying on to just continue to watch us. So now we're going to start off and I'm going to ask Jared a couple of questions.
Yeah.
So with the whole shelter in place thing going on right now, the whole COVID-19, what are you doing to just stay fabulous, staying yourself during this time?
Yeah, thank you for that question. So one of the things that I'm doing to stay basically very confident and on top of my game is I'm getting ready like I usually would if I were going out, even if I was just on Zoom meetings or talking on the phone. I'm still acting like it's a normal work day, getting up, getting ready, and still going about my day as I usually do. I think it's just so I can keep up with the routine and feel confident that I'm not, slacking or just off and not myself. So that's one of the things I've been doing.
Okay, cool. And what is one advice that you can tell the community who may be struggling with being isolated, not be able to connect with the outside world?
Yeah, definitely. I mean, it's totally understandable. This is a very uneasy and different time for everyone. So I think one great way is to stay connected. And if you don't have a group or individuals to stay connected to, our agency will be offering very soon different programs and different online resources for you to stay connected. Free of charge. All you have to do is be able to access either through your smartphone or through your computer and to be able to talk to us, connect with us, meet up with us like in Kiki Lounge or having online cooking sessions with Carson, whatever it may be, we'll have these programs provided for you just so you can stay connected and, get away from in your head and talking to us and being connected to us. So we're here to help and we're here to look after you during this really difficult time.
Well, thank you, Jared.
Of course, thank you so much. And I think it's my turn. So now I will be interviewing Rence. So Rence, just a question for you. I hope I don't mean to pry too much, but honestly, now that we're stuck at home and we have all this time and we're kind of disconnected in a sense, have you been on any social media or engaging apps?
Yes, I have, Jared, and one of those would be definitely Zoom. And and it's really, really helpful because number one, I definitely, like you, don't want to be disoriented when it comes to my schedule when or before this whole shelter in place was um, implemented. So I want to get that routine going, and also for socializing. For social media, yes, like Instagram, Facebook, but if you are asking about dating apps, I actually have been very good with just taking a break from those and realizing that this is my time now to just pamper myself and really love myself and do things for myself. And also, hopefully, when all this shelter in place is lifted, it's going to just prepare me for the outside world. Because, I feel like I am sort of like a cocoon right now. And then when shelter in place is lifted, I'm going to be just this beautiful butterfly.
Yes, I love that. So to end your questions, is there anything you would like to share with your community at this time?
Definitely not the virus. Definitely share this video and also my presence. And I invite everyone to do the same because we want to keep everyone healthy and stay at home. That's the whole point of shelter in place. And, the questions itself that you, for example, want to ask your friends, you can definitely try calling them and just ask the questions that we asked, or even do self-reflection with your own self. Ask the questions that we asked to yourself. Yeah.
Thank you so much, Rence, for that.
You're welcome. I would like now to ask Carson. Carson, let's see. I think my question for Carson is going to be what number one self-care tip you have for this time of social distancing? Let's start with that.
Okay, a self-care tip. Well, definitely try to pick up a hobby that creates something tangible. That way, all of this time actually has some marker of how things have been going. Like, I know bread usually takes about like at least a day to happen properly. If I want to do a really cool slime, it's going to take at least 4 days to make it this really cool looking thing. So at least I know how many days have been passing, which goes a long way in making sure that your mental health stays a little bit much better.
Thank you. That's so cool, Carson. Can we have a second look at that slime that you made?
Sure. This one is called an iceberg slime. So the idea is that when you look at it from this angle, it looks like the bottom side of an iceberg.
It does.
And the reason why it took so many days was you could see there's no bubbles. That whole process takes at least 4 days. That's why it's very clear.
That's so cool. That definitely gives you something to do and also something to look forward to for the following 3 days.
I love slime videos, by the way.
Yeah, totally. I see you doing some sort of educational video on that. So that's kind of fun. But for my second question, I also want to ask you, what would be the first thing that you're going to do after the shelter in place is lifted, aside from doing more slimes?
Okay, I feel like the responsible thing to do once this shelter in place is lifted is to finally go to a doctor and get the MRI they told me I should be getting, but given that I keep contacting medical care, they keep saying that that it's best to avoid going in person, but I can't do an MRI from home, so that's the first thing I'm going to do once I'm done with the shelter in place because I try to be a responsible human being. Otherwise, I feel like the one thing I want to do would probably go to definitely go out with people. I'm starting to realize now that going out and being with other folks is something I actually want to do. So I think I'm going to try doing that as soon as this shelter in place is lifted.
Okay. Thank you.
Okay, so now my turn to talk to Rowland. Okay.
Hey. Okay.
Okay, how are you staying fabulous during this shelter in place?
Oh, that is definitely a good question. How am I staying fabulous? Well, I'm trying to, every morning I try to do a routine where I still take a shower, pamper myself up and dress up, so I have that sense that I'm still going to work, but not being there physically. Yeah.
Okay, awesome. So next is, how do you think COVID-19 will impact us in the long run? Both the good and the bad.
Oh, that's another good question. I think it's gonna impact us really for a long time, especially the fact that we are being asked to stay indoors more, and that's already causing a whole change in our daily lives because we're so used, at least for me, I'm like so used to going outside, interacting with people, dining out, but the fact that we're having to just stay indoors because it's for our own good. I think it's teaching us how to value what we have currently, that things are really temporarily, so value, this could be a time where you can value time with family. And I'm trying to value that because I rarely spend time with family because I'm always out and about. So I think this whole COVID-19 is really creating such a greater impact. Yeah, there's the good parts, having quality time with family, but the bad parts is not being able to socialize and have relationships with folks in person.
Thank you very much.
So yeah, thank you all so much for sharing your experiences currently, and thank you so much, audience, for tuning in to this web series that we will be having about getting to know the staff here at the San Francisco Community Health Center. Just keep in mind that if you need anything, if you're needing services, go ahead and visit our webpage at sfcommunityhealth.org, or you can give us a call at 415-292-3400. Thank you so much, and we hope to see y'all soon.
Bye.
Bye,
Bye.
everyone.